Hello, I'm Dr. Jeff Engelbaldo, otherwise known as Dr. Plano. I'm a board certified plastic surgeon, and this is our podcast. And we just started doing our podcast, and we have a very large social media presence on Instagram, Snapchat, TikTok. But with the podcast, you'll be seeing on Apple and also on Spotify, on YouTube, and also some of the clips will be shown on our Instagram and Facebook pages. My hometown, where I was born and raised, is Queens, New York, and I left New York to go to Michigan, University of Michigan, for college and medical school. And there are certain areas of New York that I miss: the people, the diversity, the pizzas. I remember going in the subway to get to high school. It took a good hour of transportation. Actually, I don't miss that too much, the subways in New York. But I chose Michigan. Like when I went to visit the school in the Midwest, I was amazed. Like, I'm from New York City. They call it the concrete jungle. And going to like Ann Arbor was just, I thought I was like, I don't know, like the suburbs or something. I just seen on movies. And I fell in love with the school, obviously. Big Ten program, national champs. So it was a great experience to be at the University of Michigan. And I studied very hard. And then subsequently thereafter, I went to medical school there. During this time at Michigan, my parents moved and relocated to Plano, Texas. So then, visiting during the Thanksgiving breaks and Christmas breaks, I really started to really enjoy and fall in love with Plano. So when I completed all of my training in plastic surgery, I decided to move and start my practice in Plano 18 years ago in 2008. At Renaissance Plastic Surgery, we have a 7,000 square foot facility. We have over 16 staff members. We have three nurses. We actually do surgeries in our accredited surgical center. It's a fully accredited surgical center that's separated from the clinic. And we also have a very active and busy med spa. My nurse injector and myself will both inject Botox, Dysport fillers. We also have all sorts of lasers. I think we have about 7 lasers that treats all types of skin conditions. We can tighten skin, remove lesions, red lesions, sun damage spots. We can tighten skin, remove fats. We have the hydrofacials. We offer 14 different types of facials, IV infusions. We offer about 10 or 12 different types of IV infusion therapy. We also offer PRP for hair. We have a full on-site hair restoration program that involves, the hair pills, the correct ones, light therapy. We also have like conditioners, soaps. We prescribe things. We also perform hair transplants using the smart graft system, which leaves no scars. So it's a one-stop shop for all cosmetic enhancements and needs. So why did I choose plastic surgery? I've always wanted to be a doctor. I've always wanted to help people. So that was one reason why I chose medicine. And I was always good with my hands. So that's, the reason why I wanted to look into the surgical route. And I didn't realize, when you're in medical school, when you're experiencing all the different rotations, to see what rotation or surgical field you like, I really enjoyed plastic surgery. It's an amazing field. We operate on the entire body from head to toe, and it's a very creative field. It's very artistic, and I was always very artistic as a child, adolescent, teenager, drawing, entering art contests. So it was a really nice, I would say, culmination of just artistry with surgery and using your hands. So I naturally fell in love with plastic surgery. It's the most competitive program, residency to apply for. So I had to work very hard to be where I'm at, to achieve the level where we're at now. The training is very intense, and there's a lot of different facets. Cosmetic surgery is just one part of it. There's hand surgery, cranial facial, there's burns, there's wounds and reconstructions. There's a massive area that plastic surgery encompasses. And in the beginning, I did everything in my first 10 years in private practice. And then over the last 8 years, I decided just to be completely cosmetic, to become an expert in that area. So primarily 100% of my practice is cosmetic surgery, focusing on really mommy makeovers and facial surgery. Plastic surgery gives you that avenue to reconstruct, to make people whole again, to make people happy. And that's what we're doing essentially in cosmetic surgery. After having children, having weight loss, there's loose skin, things just don't look like they did before having kids. So we were making them back whole again. Our cosmetic surgery arts are really being performed to make everything look even better than how they looked before children. We're tummy tuck surgery, we're tightening skin, breast surgery, we're lifting the breast tissue, changing the shape, and adding implants makes it more rounder. So it's a really nice part of my job to make people happy and really giving them a lot of self-confidence. One of the biggest areas of people feeling very self-confident is nose. And so when someone has a hump or a wide nostril, they feel very self-conscious. And so really, when you're making a big difference, like changing someone's dorsal hump on their nose or the width of their nostrils, they feel very happy and very self-confident. So that's really one of my passions, and why I'm so motivated to work and looking forward to work every day, is just to see people happy and the changes that their bodies go through and their faces. One of the misconceptions of plastic surgery is that you go in and you come out looking like amazing. But it's not always the case. There's always risks and complications with every surgery, and sometimes revisions are needed. And you can't control that, from a surgical standpoint. And patient expectations are crucial. If they're unrealistic, you really have to show them a lot of before and afters that match their profile. And that's really key, I think, with trying to target those misconceptions about their results. So one thing that we do with all of our patients is throughout the consultation, we examine if they're good patients for surgical procedures, but we also show them a lot of before and afters. And if someone has a larger BMI, we'll show them photographs of patients with a larger body habitus. Or if someone has, regarding the nose, some people just have a hump, some people have a flattened nose, underprojected nose. There's all different aspects of a nose job. So we'll show patients those targeted areas that they feel uncomfortable with. So as long as they're realistic with the expectations and results, then we can move on to surgery if they're good candidates and they're cleared by their doctors. So once the patient calls and schedules appointments, I will see them during their consultation. They also then see our patient coordinator and get provided a quote. Once they decide on surgery and they pick a date, we'll see them a month before surgery at pre-op. And during that time, they should have clearance by their physician. They also read all their consents, and during their pre-op process, their pictures are taken, and we also talk about the risks and complications of the surgeries. In addition, after a month passes by, they come in during their surgery day, usually about 2 hours beforehand, and I'll talk to them again, all of our patients. We also mark our patients before surgery, and we also talk about expectations that we've talked about during the consult, during the pre-op, and then the day of surgery. I've always seen all of my patients, or at least try to, the next day. So we always see our patients the next day to make sure there's no issues. And you never know what can happen overnight. And it's been said that, if you have any complications or issues, it always happens in the first couple of hours after surgery. We also see our patients at the 1 week follow-up, 2 weeks, 3 weeks, 6 weeks, 3 months, and 6 months and 1 year. Now, during these times, like at the 3 month, 6 month, and 1 year appointment, they'll have pictures taken. But if someone has any issues or any concerns, they can always come and make an appointment where I can see them almost every day. We do operate, 2 or 3 days a week. So if it's during my operative days, it's usually going to be after hours around, 4 o'clock or so before I can see a patient. But normally we have our dedicated 2 days of clinic And that's when we see consults, we see our follow-ups and inject Botox and injectables. How does a person find a plastic surgeon for a cosmetic surgery? And I always tell, you know, everyone, my patients, my staff, the best way to find someone is word of mouth. And we've been almost referral based practice for the last um, several years. And it takes about a good 10 years to develop a referral based practice. But when you look and seek a plastic surgeon, you got to make sure that they're board certified, they have experience, they have a lot of before and after photographs. And you also have to make sure that the doctor is friendly, because if there are any issues, you have someone that's very personable and somewhat understanding of what you're going through. And the last thing is make sure the staff is nice. They greet you you have an experience walking into the door until you leave the building. So staff is key. And if you're not feeling that vibe, then maybe you should look for someone else. So what is a day in the life of Dr. Plano? We have non-surgery days and we have surgery days. So on my non-surgery days, we start clinic around 9:30. I actually head to the gym in the morning by 7 and try to do some cardio and do some weights, shower at the facility, and then come to the office. On my surgery days, we usually start early. I wake up around 5:30 and get to the office by 6:15, ready to mark the patients who arrive there a little bit earlier. The patients have to go through some screening, some pregnancy tests and nicotine tests prior to surgery. A lot of that stuff is done within the half hour, 40 minutes before I arrive. I then talk to the patient, mark on them, discuss expectations, implant sizes, and just the techniques of what we're doing for the plan for surgery. And then they get whisked away into the surgical room, and then we have surgeries all day. We usually average between 2 to 4 surgeries, depending on the length of surgery. On my non-surgery days, we start around 9:30 and we finish around 5:30 or so. It's usually the injectables later on in the late afternoon. And what do we do during these days? We see a lot of follow-ups, we see consults and injectables. So it's actually for me, it's busy because it's so nonstop. A lot of times, I might just have just a small amount to eat because I usually miss lunch like 80% of the time. The staff does have like a full hour break, during that time, but there's always notes to write. It's just nonstop, at least with the paperwork and that side of medicine. So what do I do outside of medicine? There's a lot of hobbies that I engage in. I was an Eagle Scout, so I'm active in the local troop here, in the Boy Scout troop with my 2 youngest sons. And that's fun because we go camping once a month, and it's just fun just to be around the children and to teach. So that's really what I enjoy a lot of my personal time with. In addition, I also collect things. I like to collect collectibles, cards, basketballs, things that are signed. I actually own a store in Dallas where I go to after hours when we're closed here. That store doesn't close till 8, so I'll be there just to see how things are going, rearranging the store, and on weekends. So yeah, I keep myself incredibly busy, and my brain has just been trained just to always constantly be doing things. I can't sit still. And I also embark on some construction projects and remodeling on the side. And that's always a fun thing to do on the weekends. But there's a lot of stuff that, other interests that's aside from plastic surgery, because at one point when you become an expert, there's so much you can learn in the area. And so I'm always reading new journal articles on plastic surgery just to make sure I'm up to speed with everything that's current. But yes, there's a lot of interest outside of medicine. The purpose of this podcast is really for education. We started our Instagram accounts and social media accounts maybe 10 to 12 years ago, and we've grown in those selective areas. And I really need an avenue, I would say, for education, awareness, just talking about different procedures. Every podcast will have a different topic. We'll also be interviewing different people of different backgrounds related to the field of plastic surgery. So it's going to be a very fun educational podcast that we'll be having here at Renaissance. And hopefully you'll enjoy it. So now this concludes our podcast. Thank you for watching it or hearing it in your cars. And we're going to be coming out with these educational podcasts every maybe twice a month. And you'll also see it on YouTube, Instagram, Spotify, and Apple. Well, enjoy your day. Take care.